So to begin, Assembly Bill 33 is a piece of California legislation that deals with public health and is also a window of opportunity policy. So essentially, what it aims to do is create a task force to collect and organize the data as it pertains to the misuse of fentanyl in the state of California. And it also seeks to evaluate the approaches to increase the public's awareness of fentanyl misuse. This is a window of opportunity piece of legislation because it correlates with the rise of opioid use across the state and across the nation. That also correlates with the COVID pandemic. So, as previously mentioned, it was observed in the state of California and across the U.S. That there was a rise in opioid related deaths. Specifically, with fentanyl in the state of California, we saw a jump of 121% from 2019 to 2021, with opioid related overdoses, with over half of those being fentanyl related deaths. Also, we see that fentanyl use, the illicit manufacturing of fentanyl, has contributed to the lethality of fentanyl, and in turn, more overdoses, and the addictiveness of fentanyl. It is highly potent, 50 to 100 times more potent than morphine. Some of the populations affected include unhoused individuals, youth and young adults, racial and ethnic minorities, and individuals who are who have substance use, have a history of substance use, or currently um, have substance use disorder. And this graph just kind of shows the rise in opioid related deaths. And then this graph also categorizes the fentanyl use rise. And you can see that here in 2019, there was just a huge jump, and then a even larger jump in 2021 and 2020. So, again, this piece of legislation aims to combat that and really to curtail deaths related to opioid misuse and specifically fentanyl misuse. So, because it's super new, it's not being implemented till June of 2024. Some of the hypothetical system failures or failures at the system level could be the inability to implement, just because California is a huge state with 58 counties, and there may be a lack of adequate resources to really accomplish this. In line with that, there could be inconsistencies in implementation, right? So, again, with the 58 counties, some counties may have more resources than others, and that can lead to inconsistencies in the way that this is implemented, the task force is implemented. So, the bill received a lot of support across different domains like healthcare, law enforcement, community public health, and mental health, of course. Some of the stakeholders include the California Behavioral Council of the Behavioral Health Planning Council. And basically, what they do is inform legislation as it pertains to public health. And they are instituted by the Department of Healthcare Systems or Services in the state of California. Another stakeholder would be the author. She is a physician, Dr. Jasmeet Baines. She is the author and the forerunner of the bill.
Hi, I'm Christina, and I am focusing on what is being done on a federal level to combat the ongoing opioid crisis in America. So, with this bill, AB 33, it really looks at scheduling fentanyl to be a Schedule 1 drug. So, you might be wondering what is a scheduled drug and what does that mean? So, the DEA classifies and analyzes where drugs should be. So there are 5 schedules, Schedule 1 being the most detrimental, Schedule 5 being the least. That is not to say that a Schedule 5 drug won't have any harm or effect on an individual, but wherever it is classified in the ranking appropriately explains what a drug can do and its harmful effects. So right now, fentanyl is Schedule 2, but they're wanting to up it to Schedule 1. So with that could also come harsher penalties with the distribution of fentanyl, so that can result into possibly 1 year in prison. Typically, individuals who are caught with this contraband can be faced up to 2 to 5 years in jail, but being a Schedule 1 drug could result in 1 year in prison. With that being said, this bill enforces that task force members analyze and collect data and assess strategies to promote public awareness of this drug. Although the word task force may sound something that comes from law enforcement, actually these task force members are members of the community. So we see several educators, whether that be professors, who conduct research to see what effects this has on an individual. We have chief officers from different local law enforcement agencies throughout the country. And we also have community members who are determined to fight for this cause and really prohibit this deadly drug from taking the lives of many individuals across the states. So federal actions on fentanyl. Right now, legislation have introduced and passed several bills to target the fentanyl opioid crisis, including measures for enhancing border security. For example, the Synthetic Trafficking and Overdose Prevention Stop Act aimed to combat the flow of illicit fentanyl through international mail systems. So it was being sent through different mail systems, and so that specific act, the Stop Act, was focused on prohibiting that to being distributed. Another example, this is specifically for the state of California. The Medical Board of California mandates that physicians have access to databases to verify if a patient is already prescribed medication, and if so, how many medications are they taking before they can prescribe more. And lastly, law enforcement has increased their searches and investigations to enhance border protection. So that would be federal law enforcement that have the authority to do that in order to stop it from being distributed again across the states. So in terms of federal regulations, the importance here is enforcement prioritization. So really the goal is to place fentanyl in that Schedule 1 category. Placing it in that category really signals that this substance displays a significant concern to the public health and safety. For example, former President Donald Trump did call a public health emergency during the opioid crisis. And so with that, kind of we've seen a new array of ideas that stemmed from that public health emergency and its importance. Again, federal law enforcement agencies such as the DEA and Homeland Security investigations really work to disrupt the production and trafficking and the distribution of illicit fentanyl across the borders. So it's important that it stops before it gets into the states. So this is a freshly new bill. It was commenced in September of 2023 and received approval from both Senate and Assembly. It was a 5-3 vote. And these are some of the Assembly sponsors. At present, this task force is newly established, so I kind of found it a little bit difficult to find information on available funding that's being allocated to this policy specifically. So political party support and opposition. Right now, there is a lot of articles that talk about what both political parties think. However, they both believe that this fentanyl has become an opioid crisis. There isn't a question whether who thinks it is or who thinks it isn't. They've come to the agreement that it is something that needs to be addressed, and it's very important that it's an emergency. However, While reading articles, it is evident that the Republican Party points the finger to the Democratic Party for not tightening the border security. So again, they're not looking at what's happening right now. They're really looking at border security and where it stems from. So before we can stop it in the United States, we need to stop it at our borders. All right, so what are some challenges and limitations? So the whole idea of this task force is to collect data and really analyze that data. However, gathering accurate and good data can be a little bit challenging. You have to track the overdose deaths, you have to track the trends, and with that, it can be complex. And not only could it be complex in itself, but there's several parts to it. For example, there has to be collaborations with various stakeholders and agencies, and so they have to be able to do that right and appropriately in order to get accurate statistics. Physical limitations, so there's several limitations on law enforcement, and this is because specifically there is a belief that this is an international trade issue that's going on, and so federal law enforcement can only do so much physically, but again, they have to collaborate with countries overseas on seeing where it's coming from and things of that nature. Be positive, whether that be a state, local, or federal level, but when we look at it in the scope of a federal level and the drug abuse, it displays a significant concern. We've seen a rise in deaths across the states, and so what is this policy going to do to address that problem? So right now, this task force conducts public awareness campaigns to educate communities about the dangers of fentanyl and opioid misuse. We see a lot of people talking about it now. There's also been an increase in selling of Narcan, which can reverse the chemical reaction of fentanyl and its harmful effects. And really to promote safe medication practices and encourage individuals to seek substance abuse. Additionally, the task force advocates for the expansion of treatment and harm reduction services for individuals affected by fentanyl addiction. Again, whether that be through medicated assistant treatment programs, overdose prevention programs, or the distribution of naloxone, which can reverse the chemical reaction in the person's body.
So what is the goal of this policy, AB 33? The goal of the policy is to prohibit and or prevent a person from possessing fentanyl. This includes the sale or purchase of purpose of sale, specifically fentanyl or any controlled substance including fentanyl. If violated, this will result in imprisonment in county jail for 2, 3, or 4 years. What bill currently supports this is the Senate Bill 19. Fentanyl Misuse and Overdose Prevention Task Force adds to Section 11455 of the Health and Safety Code. This is related to controlled substance, and this bill was approved by Governor Newsom October of 2023. Who is covered by this policy? This policy does not exclude anyone. Anyone caught with this fentanyl controlled substance will result in a misdemeanor and jail time. Social problems related to this policy are targeted as a result of overdoses with adolescents between the ages of 13 and 19 have increased over the last few years, reported by the CDPH. Some interventions that are being done. SB 19 is collecting data to observe all of these substance overdoses. California Department of Public Health is allowing grocery stores, gas stations, pharmacies, and schools to now have Narcan, which is a life-saving form of medication. You can also purchase testing strips to test for fentanyl, as well as STOP is an overdose act that is also created under Senate Bill 10. Along with Substance Abuse and Mental Health Service Administration, they are creating awareness and campaigns to focus on awareness, empowering youth to create opportunities, and educate them as to the dangers of fentanyl. So, what is Riverside County doing about fentanyl use? Riverside County District Attorney has initiated an educational campaign through social media platforms, working with Corona Chamber of Commerce to spread awareness through posters, videos, stickers, and billboards. The Board of Supervisors, Drug Administration, DA, and law enforcement are also collectively collaborating to create educational trainings and awareness around the community. Who administers this policy? Superior Courts of California, Department of Public Health, law enforcement, nonprofit agencies, wellness agencies. Melanie's Law has also required middle and high schools to produce a plan to prevent and respond to fentanyl overdoses, such as using Narcan.
Okay, why the policy is important. So, the crisis surrounding fentanyl, a potential synthetic opioid, has reached alarming proportion with a dire consequence for public health on both sides of the border. In the United States, the year 2017 witnessed an astonishing toll of over 70,000 lives lost due to drug overdose, a substantial portion of which can be attributed to the influence of fentanyl. National Institution of Drug Abuse 2019. Canada faces its own devastating reality with a staggering 10,000 fatalities record between January 2016 and September 2018, underscoring the severity and urgency of the issue. CBC 2019. The gravity of fentanyl crisis is encapsulated in a designation as a threat to the public health and safety. Guyana 2016. Health Canada has identified the myriad of dangers associated with fentanyl, including its odorless and tasteless nature, often making it imparable when mixed with other substances such as heroin. Notably, the drug is frequently combined with other opiates to enhance its potential, amplifying and distributing trend that contributes to its lethality. Health Canada 2019. A particular disconcerting facts of fentanyl is its potency, whether within a misuse amount, roughly equivalent to the size of a few grains of salt, can prove fatal to the average adult. Health Canada 2019. The repercussions of inherent potency are evidenced in the alarming statistics that emerged between 2013 and 2014, during which the number of individuals succumbing to fentanyl-related overdose surrounded by an alarming 426%. Winter 2017. This precipitated what is now widely recognized as the world's worst opiate crisis of North America, a crisis that continues to exact an unforgiven toll on the well being of communities. In light of the grim realities, it is essential to embark on an exploration of the interact phases compromising the fentanyl crisis. Only through a comprehensive understanding of the root cause and dynamics surrounding fentanyl abuse can effective strategies be formulated to curb its devastating impact and protect vulnerable populations at the epidemic of the burning public health emergency. Biblical views on this policy. Aimed at an escalating prevalence of fentanyl within our community, biblical principles guide us to reflect on self control and moderation. The scripture cautions against the misuse of substance that can compromise judgment that leads to addiction, a perspective underscored in verses such as Proverbs 21. Furthermore, the Bible recognizes the critical role of authorities and leaders to uphold justice and safeguarding the welfare of the community. Romans 13, 1 through 7. The God given authority vested in the government, emphasizing the duty of rulers to foster goodness and combat wrongdoing. The biblical calls for fairness and equality resonates in the content of policy making. Proverbs 29:7. The righteousness concerns for the right of the poor. In the present era, these policies often originate from individuals who keenly grasp the prevailing issue and passionately strive for change. When they identify a problem, these individuals voluntarily step forward to change policies aimed to improving the circumstances of the less fortunate and fostering positive social change. These proactive approaches resonate with biblical principles that urges us to persuade justice, embrace mercy, and trend humility as they comfort the change affecting our communities. So how does this policy connect with the NSW? When I think of the NSW, the first one I thought about was service. The NSW values the provision of service that enhance the well-being of individuals and communities. The Fentanyl Misuse Overdose Prevention Task Force likely aligns with the values by addressing the critical public health issue and aiming to prevent harm caused by fentanyl misuse. Another one is social justice. The NSW promotes social justice and advocates for fair, equitable access to resource, opportunities, and treatments. The task force focuses on preventing fentanyl misuse overdose aligns with the social justice principle by addressing a public health crisis that affects vulnerable population. And like this, there's many other ones. You can continue reading on the slide I selected. Thank you. So some of the barriers and holes that we currently see with this bill is the bill is currently encountering several obstacles. So it mandates that a annual meeting of the task force must be occurred by June 1st, 2024, with subsequent meetings scheduled at least once every 2 months. Additionally, the bill stipulates that an interim report must be submitted to the governor and to the legislature by July 1st, 2025. Furthermore, the task force is required to present its findings and recommendations to the governor and to the legislature by December 1st, 2025. This is California AB 33 check bill. So what this meaning is that we're going to see not right away go into effect, right? They need to grab data, have meetings, and see what is going to be determined in order to get this bill in true effect.